Now, I appreciate the opportunity to speak about my experience. As you said previously, my name's Tom Brays. I live in Mareeba, which is in far north Queensland, with my wife, who was diagnosed in April of 2016 at the age of 60 with stage 4 advanced ovarian cancer. People speak about the fear of recurrence. We've not had that, as we've not had remission. Ours has been one long period of treatments with some small breaks of a few months between treatment regimes. Treatments have included chemotherapy, surgery, a drug trial, and a number of alternative treatments. First up, my wife and I agreed she was not going to be a victim. That is, sit around with a poor fellow me attitude. We would do what we could to beat the disease. When it comes to emotions, I'm certainly not a medical professional. I don't know what the recognised emotions are, so I'm only speaking from my own experience and general knowledge. Whatever your entry into the club, you may have been told early on, as we were, you have ovarian cancer, there is no cure. Maybe you didn't take in much more of the consultation. Your brain and emotions were already in overdrive. Since then, your emotions have been fluctuating up and down for no apparent reason, or because something that has been said or happened. To be clear again, I'm not a psychologist. I can only speak from my own experience. So, like me, you may have experienced fear of the unknown, of the future. We attended a cancer retreat at the Gawler Foundation a couple of months after my wife's diagnosis. In a group session, we were asked about our fears. I responded with the fear of being alone. We've now been married almost 45 years. I don't want to reinvent myself to find a different life. I want this one to continue. After 5 years of living experience, I think I've come to grips with this, but it's not something I look forward to. I live in hope that advances in medicine will allow us to live out our lives together. You may, of course, experience anger at the doctors, at the world, because your partner should have been diagnosed earlier. You will find a common theme throughout what I say, and that is that you don't have to handle these emotions on your own. Accept help. You may have experienced frustration and confusion at not knowing what's coming next. What should I do? What does this mean? How will it affect us? And at the apparent loss of control of your lives, which now revolve around doctors and treatments. Also, frustration at the medical staff, who do a wonderful job, show compassion and genuinely care for you, but who sometimes seem to forget that you do have a life, that you may live outside the CBD, and yes, although you can be there at that time, at that place, you have to arrange time off work, flights, accommodation. You don't just live down the street. Seems that some receptionists think that you might. You may, of course, experienced anxiety and worry, the biggest negative emotion of all, it seems to me. It will drive you into the ground if you let it. I found that if you embrace the services available to you through the Cancer Council, or I believe Ovarian Cancer Australia, or your employment, or privately, you can manage anxiety. My motto has been for many years, since an earlier traumatic period in our lives, to live in day-tight compartments. The load of yesterday, added to that of tomorrow, carried today, is enough to make the strongest falter. I found this in the book by Dale Carnegie, How to Stop Worrying and Start Living. I credit this book with saving my life when I was in a very dark place. Of course, we will have experienced sorrow. As I say, don't adopt a victim mentality. It would be unusual not to feel sad given the circumstances. I don't believe there's anything wrong with wearing your emotions on your sleeve. If you feel sad or you are sad, be sad. Or if you cry, cry. But don't become consumed by it, and don't be afraid to seek professional help. I have found that talking to the psychologist is very beneficial. Something that I suffered, and you may have experienced, is bouts of spontaneous crying. Well, it happens. It may be in the shower or wherever. The brain must just turn over the emotions and bang, it happens. Also, it can happen when the most caring person asks you how your partner's going. The lip can curl, the eyes can water, and you can't answer. You might just have to walk away or put the phone down or dry your eyes and compose yourself. Horses for courses. I've always been very honest with people, maybe too much so. It would be easy just to say, she's doing well, or she's having treatment. But I find myself being more informative, which is maybe a mistake. Again, it depends on you and the circumstances, how you handle these encounters. I think Oliver mentioned this, and I certainly found it extremely difficult, and that is anticipatory grief. This did take a few years to appear for me, or at least until I understood what it was. It is real. You are not living in day-type compartments, and you're grieving something you think is going to happen. A couple of hours with a psychologist assisted me on that front. You may or may not have thought about suicide. As sad as this sounds, you might find yourself with suicidal ideation, that is, suicidal thoughts. This might be an extreme emotion response to the upside-down world you have been thrown into, but I've got no doubt the pressure male partners endure could lead to these thoughts. You'd not be thought of badly if you were to experience this. But again, help is there. Don't be a rock. Seek help. If you've not already sought any help from Ovarian Cancer Australia or maybe your psychologist, consider opening a line of communication. Do it early. Break the ice. Even do it regularly. So if you encounter a dark despair, you have someone to relate to. Lifeline is always there on 13 11 14. Put that number in your phone with other supports like your GP, Ovarian Cancer Australia, and your psychologist. Sometimes we hear people talking about, and I don't know whether it's an emotion, but what I call the why me emotion. Well, to be blunt, why not me? Around 1,500 women in Australia are diagnosed every year with this disease. The more you hang around hospitals and doctors' rooms, the more you start to wonder how you in fact escaped any illness yourself. It seems everybody has it. I've never had a why me attitude to this or anything else. It seems like such a futile exercise. We're in this boat, unfortunately. Better row it as best we can. Now, Kim spoke extensively about sexuality. This obviously can be a real issue. I don't think there is a one-size-fits-all. How you react sexually will depend on a range of influences. But remember, your partner has a serious gynecological disease. She's been thrown a curveball. She's receiving potent poisonous chemical treatments which sap her of energy. She's just getting over the last lot of treatment, starting to feel normal, and then it's time to start the next round of treatment. She may have had major surgery, which might have meant the removal of her female organs. Intercourse may well be painful for her. Intimacy may be physically possible, but would not be hard to imagine that a woman's desire might wane. Age may be relevant. You may have a similar experience. Your age, anxiety, fear, etc. may also mean your desire for intimacy wanes. No doubt this is easy to handle if both of you are feeling the same. If this is an issue for you, I could simply say, speak to one another. Speak to your psychologist. Be mindful and respectful of your partner's situation. Try to introduce things that are enjoyable, so you're still enjoying one another's company and love. Going to the movies, the beach, introducing other activities instead of just falling into the routine of doctors, hospital and home. In our case, we might stay in Cairns overnight, generally the night before treatment. We might also go and sit on the beach, or we might introduce a detour. On one occasion, we had an appointment to see the specialist in Brisbane. We went via Perth and the Indian Pacific. A bit of an extravagance perhaps, but we created memories which we now enjoy instead of just a trip to the doctor in Brisbane. There are other matters which I might touch upon. Your role as a male partner. From where I sit, I think my role is to support my wife. That's a very broad statement and encompasses all sorts of considerations. I don't know if you'd use the word rock. It's more than that. You have to blend into the new reality, accept the situation, and work within the parameters of your new world. You may take on more of the household duties. You may take on medical administration role, making sure appointments are kept, travel forms obtained, prescriptions kept filled. While I say this, you should not usurp your partner's independence. She should also try to maintain a sense of normality, especially when it comes to family and friendship groups. Obviously, this can all be a day-to-day proposition depending on her strength and wellness. We've been lucky, the oncologist says. You are clinically well. It's just that you have extensive disease progression. My wife has, as far as possible, which has probably only been about half her usual commitment, continued her involvement with our Lions Club, her Pictionary group, the Mahjong group, the ukulele group, yoga, swimming, and various alternative treatment programs. A lot depends on attitude. Keep a positive mental attitude. Stay calm. Have no care for the morrow. Well, that's all easier said than done, isn't it? How the hell can I maintain a positive attitude when I'm dealing with this illness? Take on more of the household duties, maintaining an income? It's hard, but try to prioritise. Do the things that have to be done. And if you can't, they'll have to wait until tomorrow. The other attitude is defeatist. You may have people or seen people who just adopt the I am defeated type of attitude and let their will fall apart. I can't be critical of that, and it is explainable. But it is possible, with the help of friends, family, and of course the psychologist, to maintain a healthier attitude, something of an acceptance with a commitment to give it all you can. We, of course, depend entirely on the medical profession. There are many outside influences that impact your emotions. Doctors may be one. They are good, they are bad, they care, they don't care, and so on. Overall, I think we're very lucky. As I've mentioned before, one of the recurring things is that doctors and medical staff don't seem to think that you still have a private life, and also that it has a time frame and schedule. Something which we discussed very early in the piece, probably because of my background, was estate planning. When we attended the Gawler Foundation Cancer Retreat in the Yarra Valley, we had a number of sessions, joint sessions. There were plenty of uncomfortable things to talk about, such as living and dying, but it's a reality. There are things you need to be considering: your wills, enduring power of attorney, or an advanced health directive, which might in some states, I think, be called a living will. You need to discuss these things while you both have capacity. Do it now. What your partner prefers when it comes to, do you know what your partner prefers when it comes to burial? Does she want to be cremated, buried in the lawn cemetery, flowers or not? As hard as it may be, it will give your partner peace of mind to know that her affairs will be organised and dealt with in the way that she would prefer. And it will save you the anguish of making these decisions when, very suddenly, being asked by a funeral director what is to be done. As we grew older, we were dropping or reducing our various insurance covers. I was actually doing this around the time that my wife was diagnosed, when I realised we had an old trauma cover. I checked, I made a claim. I thought it'd be like pulling teeth to get anything out of the insurer. But to my surprise, once I had the GP and the specialist complete a form, the money was in our bank account within a week. So if you've not, it may pay to check any old policies you have. And of course, your partner may have life insurance within superannuation. It may pay to check that as well. My wife and I discussed whether I should retire when she was diagnosed. We decided I should not. In hindsight, that was for us clearly the correct decision. It has meant that we've had a secure income, and I've had a lot of support with time off. I've also benefited from staff supports in the form of free psychology sessions. And now I am ready to retire, and will do so later this year. In Queensland, we have the Queensland Cancer Council, which was for us a good first port of call Obviously, Ovarian Cancer Australia is a source of support and advice. If you are unsure or a bit lost, just contact the cancer councils in your state and explain what you're feeling and ask them for direction. These supports may be extremely important if you find you're drinking uncontrollably, dabbling in illicit substances, or gambling. The last thing you want is to lose your driver's license because you had some stupid binge drink. It may sound like a broken record, but if you find you're hitting the bottle more than is healthy for your relationship, then you should get help. Vanessa, back to you.
Wow, thank you so much, Tom, for being so open and honest and sharing your experiences caring for your wife. I know everyone watching will have been inspired, by your incredibly positive attitude. So thank you very much. We do have a couple of questions. The first one, what was your wife's CA125 when she was diagnosed, and how has it moved since then?
The dreaded CA125 marker. There's also a CA15.3 and other markers, but the one that we probably hear about most is the CA125. I don't know why, maybe because there's nothing available to measure the progress or otherwise of the disease other than scans, but we become hooked on the CA125 marker results every time there's a blood test. In my wife's case, when she was diagnosed, her CA125 marker was about 4,000. It has been going up steadily ever since, except for when she had surgery, it dropped, but it's currently somewhere over 14,000. You may feel elated when there's a reduction in the level and devastated when there's an increase. I think at times become too dependent on this test result, suffering a fair degree of anxiety waiting for the results. And then subsequently, when the results have shown an increase, but now after 5 years, although we're aware of the effect on us, we still want to know. Although now my wife only asks to be in for that CA125 marker to be included about once a month when we see the specialist instead of what was every week when she was having chemo. The other thing it seems to me is there's not a lot of uniformity of scale. I've heard of women being told by the doctor that a very low reading was a real concern, whereas, as I say, my wife's kicked off at 4,000 and is now around 14,000. So all I can say about that is try not to become obsessed with it. I think it should be given its own syndrome, frankly.
Good tip, Tom. Thanks. There's one more question. I know we're running out of time, but I think it's a good question. What alternative treatments have you pursued? And would you recommend that we consider treatments beyond the mainstream treatments offered?
Pawpaw leaves, eating your own poo. There are many alternatives out there. You just have to look for them. My advice is that you need to really rely on and work with your specialists. In our case, we've pursued alternatives since day one, but always after discussing with our oncologist. We don't want our actions to be at odds with the primary medical treatment. I don't think that we've ever had any encouragement, just a bit of a sigh, a roll in the eyes, and maybe you're wasting your money. But the things that we have pursued is intravenous nutrient therapy, which is essentially large doses of vitamin C, magnesium and zinc, massage, colonics, which is washing out of the colon, enemas, meditation, lots of, diet, acupuncture, hyperbaric treatment, hypothermia treatment, supplements, naturopathy, and overseas treatments. In 2019, I think, yes, 2019, we went to Japan twice to see Dr. Teranuma Hiroshi in Japan, where my wife underwent a series of immunotherapy treatments where her blood was taken, enhanced, and then given back to her. But they're the sorts of alternative treatments which we have pursued. The difficulty with them is, of course, we don't know whether any of them work. There's no way to measure these things. But if we hadn't pursued those things, then perhaps she wouldn't have survived the 5 years as she has done. Vanessa?
definitely something to think about. Thank you, Tom, and wow, what a journey you've been on. It's incredible. We wish you all the best. Thank you so much again for your time, and like I said, just for being so open and honest in sharing your experiences.